The early stages of labour is often called the latent phase. This is when your cervix will start to thin and become stretchy, preparing to get ready to open in labour so you can birth your baby. This stage is different for everybody and is often the longest stage of labour if it is your first labour. It is normal to last for hours or sometimes days. Some of the changes that will happen to you might not necessarily happen in the same order, and some of the changes we talk about might not happen to you at all. However, your baby should move the same amount as it usually does. If at any point you are worried about your baby's movements, if you have any bleeding, or if you are not yet 37 weeks pregnant, please contact the hospital you're booked under straight away.
It's recommended that you stay at home for this stage of your labour, so you can relax in the comfort of your own home. You should call your midwife when your contractions become regular or if your waters break. During this time, it's a good idea to have something to eat and to drink plenty of fluids so that you have energy for later in the birth when you may not feel like eating. Try to rest or sleep as much as you can.
During pregnancy, there's a plug of pink jelly-like mucus in your cervix that keeps your womb a sterile environment for your baby. When the cervix begins to open, sometimes this mucus plug will come away. It might come in one blob or in several pieces. Midwives call this a show. This can be an early sign that you are in labour. However, you can also have a show earlier in your pregnancy, and it does not mean your labour is going to start.
Another early sign of labour is when your waters break. You might not have had any contractions when your waters break, or you might have been having contractions for several hours. It's different for everyone. The water is the amniotic fluid that has been surrounding your baby. You may feel a slow trickle or a sudden gush of water that you cannot control coming out your vagina. Amniotic fluid is clear or slightly pink in colour. Tell your midwife immediately if the water is smelly or coloured or if you're losing blood. You should call the hospital you are booked under once your waters have broken, even if you are not having contractions. If you have been told you have Group B strep, you will be asked to come in straight away.
If your contractions don't start 24 hours after your water's breaking, your midwifery team and obstetric team will want to discuss a plan for induction, as there is an increased risk of infection for your baby. Contractions feel different for everyone. The best way to describe them is intense period pains. Some women feel pain in their abdomen, whilst others feel pain in their back. When you're having a contraction, the muscles in your womb tighten as they push your baby down towards your cervix, and your cervix begins to thin, ready for your baby to go through.
There are things you can do at home to help you cope. Paracetamol is considered safe for you and your baby. If you feel as if your contractions are painful, you can take paracetamol every 4 hours, up to 8 tablets a day. Try any relaxation techniques you've been practicing, or get your support partner to give you a massage. You could even watch a film. Concentrate on your breathing, especially during a contraction. Try to breathe out as slowly as possible. You could have a warm bath or a shower, or use a hot water bottle, which will help with any pain and help you relax.
Established labour is when you are having regular, painful contractions and there are changes to your cervix. If you go to the hospital too early, you may be asked to return home and come back once your labour has progressed slightly.
Remember to contact your midwife if you're having regular painful contractions, your waters break, you have any blood loss, you are worried about your baby's movement, or you feel like you cannot cope at home anymore.